So obviously the coronavirus is on everyone's mind right now, and what we thought we would do is talk about 5 things that are related to the coronavirus that people might find interesting. And we've even got some good news items. I've asked secondstreet.org contributor Chris Sims to help me out and have a good discussion about lots of different things about the coronavirus, including nice things, positive news that I think a lot of people need to hear right now, and even you've come up with some good ideas too that you've seen around the internet that people can be doing at home while they're squirreled away. So we'll get to those. But Chris, why don't we start off with some sort of analysis, I guess, that you've done in terms of how the coronavirus pandemic right now compares with the Spanish flu that happened in around 1918 to 1920, I believe.
Yes, exactly. It's one of those things that I've been reading about a lot over the past few years, and unfortunately, much more recently. I'm sure a lot of our viewers and folks are feeling the same way. There's a lot of comparisons between then and now, our pandemic now and the pandemic then. So, the so called Spanish flu was out around 1918, just at the end of the First World War, and it actually took millions and millions of lives. It was really devastating to a lot of European and North American cities and into India as well. So it really spread all around the world right after the end of the Great War. And so a lot of folks now, especially journalists, are looking back in time and they're looking at pictures from the time of the Spanish influenza. And they've got pictures of people trying to ride rail cars with these big white masks on their faces, people trying to be quarantined, trying to stay away from each other. And they're asking, how do things compare now? Well, medically, I'm not a doctor. Medically, number one, it's a completely different form of a disease. That was a flu. It was a form, apparently, as far as researchers are concerned, a form of H1N1, and you can read a lot about that stuff online. And it really took a lot of lives of otherwise young, healthy people. People between the ages of 20 and 40 passed away from it in really upsetting numbers. And so I think a lot of people are reaching back to that time and trying to compare to now. And if I can give some folks some hope compared to now, there's a lot of differences that we have now. We're much more able to sanitize our environments here especially in North America and in our urban environments. We're better able to get the word out of people saying, hey, maintain social distancing, make sure you wash your hands. The understanding of even something like germs is much more prevalent nowadays. We're able to tell each other to wash our hands, to even use something, an invention like hand disinfectant. That didn't exist then, really. We had to be much more careful then. Whereas now, we're able to get that message out through technology to let people know, number one, when they need to stay home, and number two, keep them updated on the emergency prep. Back then, they weren't able to get the word out as fast as they otherwise would have wanted to. So I wanted to encourage people in that sense that we're not in those same times. And as you and I are talking right now, using these web cameras, we need to really step back and marvel at how technology is playing a role here on allowing us to continue to work, on allowing doctors, for example, to talk to their patients over webcams, of getting older folks to be able to participate in family events still and see their grandchildren. So the isolation isn't going to be nearly as keenly felt as it would have been without these sort of technological advances. And so I wanted to give people a little bit of encouragement. I know things are tough right now. Things are changing hour to hour. A lot of folks are anxious. But if we compare it to last time we had a pandemic, we've got a lot of work on our side. We've got a lot of technology on our side, and it seems like our infectious disease specialists, especially at levels of government, are really able to keep us up to date minute by minute.
Mhm. I think too, even with the science advancing too, you mentioned technology, but science advancing as well with um, just a lot more awareness about the human body, how it works, viruses, how they spread, the sharing of, you mentioned sharing of information, well, sharing of information between scientists
Mm-hmm.
too, and working to collaborate and find a vaccine for this. And we'll talk more about vaccines in a minute. But the other thing that I think about too is even, the size of homes are a lot bigger than it was 100 years ago. So if
Mm-hmm.
you do have to social distance, people can even do that in their homes, I think, a lot more easily than what they could have done 100 years ago.
Yes, exactly. Good point. We're not as in close quarters as we were 100 years ago. There's also, as you point out, the specialists and scientists. We have to keep in mind that there are entire, if you want to read about it, I don't know if now is such a good time, but if you want to read about it, there are entire teams of epidemiologists. These are infectious disease experts from around the planet, and they all collaborate and they all share stories and they all share data. They're working on this stuff year round. There's, in fact, entire panels of people who watch for what the next flu will be. And then they have a huge meeting for real. And that's how they all decide what the next flu shot should have in it. Because
Mhm.
they can see different emerging trends in flu, for example, and then decide what should be in that coming fall's vaccine. So the fact that we have so many brilliant people on this right now, so many people working on it, it should be encouraging. I know for me personally, it's quite encouraging.
I'm certainly encouraged too, and I look forward to talking to the good news section. Although we've already given a bit of a hint there. We've got the five things we're going to talk about. I want to go to number four, and this was actually something that a former politician had talked about earlier than I thought we would have seen other politicians talk about. I think it's very important. Brad Wall, former premier of Saskatchewan, tweeted, I think it was about 4 or 5 days ago now. He said, your local restaurants are seeing a drop in numbers. Your favorite independent local artists have had gigs and entire tours canceled. That's their bread and butter. So this weekend, if you can, order takeout, buy some gift cards, and go online and buy some merchandise. I think that's a very important thing to think about as we talk about this whole coronavirus, is the effect on business. It's the engine of the economy. You don't have government unless someone's producing something or providing some kind of service and paying a tax on top to support government, that whole sector. Nonprofits and charities are also funded too by people that are originally working in the business sector and not. So it is crucial to support the business sector. Obviously, right now it's tough in a lot of cases because people they're trying to self isolate, stay at home. It's hard to go to a restaurant if you're in that case. You probably don't want to go get your hair cut and all those other things. I think former Premier Wall has a good point about even doing things like buying gift cards, online shopping, if you can afford it right now.
Yes, exactly. I thought that was a brilliant suggestion. And another person I saw online had also recommended the same thing, buy a gift card. So, right now, you may not want to be going and, like you said, getting your hair done or getting your nails done or buying those gifts. But if you were planning on doing so anyway in the next 3 months, why not do it now and then use it later? So you can give them that money now to help tide them over through this really tight stretch. And then hopefully, once we all healthily emerge from this trial, I'll put it that way, will be able to actually use them. But in the meantime, you've helped that local business stay afloat and you've helped that family because behind every business are people. I think
Mhm.
sometimes it's easy to get lost in the woods of narrative and just think about people and businesses. Well, no, businesses are people. They're your neighbors, they're your family members, they're your folks who make up your community, and they can quite often have leading roles in your community. These are the same ones that are going to city hall meetings and trying to hold people to account and who are also donating to, your local Girl Guides and helping to plan that parade down Main Street. These are your local businesses. And so if you were going to be patronizing them anyway over the next little while, definitely a great idea coming from former Premier Wall to give them that money now in the form of a gift card without any contact or risk of spreading, but then using it later. It would probably be a big help for a lot of folks. I know we're doing that here in our local town as well, including with things like your bookstore, your local bookstore, things you wouldn't otherwise think of. You think, how much would I be spending otherwise over the next few weeks there? Let's do it now. And that way it keeps them going.
Yeah, and I think one other good idea too is if you don't have the financial means right now, a lot of people have lost income because of this, and maybe they're not in a position to help out a business. But maybe what you could do is share some information about that business on your Facebook page, your Twitter page,
Yes.
whatever, and just remind people that hey, if you do have some cash, this business is struggling, and here's they're selling this online or whatever. Just
Now is a great time to write that Yelp review that you kept meaning to do,
yeah,
to
yeah,
give that 5-star shout out to somebody. Because if you've got time, you might as well go for it if you don't have the money.
exactly. Now, I want to shift gears a little bit and talk about preparations for times like this. Obviously, we're in the middle of it, so it's a little bit harder for people to prepare than, say, 3 weeks ago. But I know that this is something that you and your family have been um, I'll say studious in, is
Hmm.
just making sure that you have some extra food around the house in the event that we do run into something like this, and it's something that you've studied and looked into. Do you have any thoughts about where we're at right now and things people may want to keep in mind?
That's a great question. As you said, we're in the middle of it now, and so we don't want to overtax people at this point. But if they can still do some responsible online shopping or some local shopping that doesn't harm or impact anybody negatively, the idea of emergency preparedness of most emergencies is always a good idea. Because, for two reasons. Number one, that means that you will be able to help your own family and your neighbors. So you won't be taxing other folks if there's ever another emergency that comes down the pipe. And number two, for your own mental health. If you have a store of food or basic emergency supplies or that medical kit that you've been meaning to put together, if you have it put together, you can sleep a little bit easier. It does, at least speaking for me, it does decrease your anxiety, because if you know you're good for so many set of days, however long you're comfortable with, you can then be helpful for other people and you won't have that, oh, I was caught worry. And so I actually started researching this after 9/11. I was working on Parliament Hill when 9/11 happened. And I remember distinctly getting home. And I was one of those lucky ones that was able to walk home. It took me, a little more than half an hour. I wasn't in peril. But on my walk home, I was thinking about all those folks in Manhattan who were having to walk a long, long, long way. And months later, I was reading about them, and a lot of them had to walk home either in their high heels that they were stuck in from work or barefoot because they just couldn't stand it anymore. And after that, that got me thinking about emergency preparedness and what we can do. And it doesn't need to be, God forbid, a pandemic or something as terrible as 9/11. It can be a natural disaster. It can be a flood. It can be a hurricane. It can be your power going out for several days on end. And I started asking myself, what sort of things could I do for my family in order to make myself more secure? And I would highly recommend actually going to the Government of Canada website. If you just Google Government of Canada Emergency Preparedness List, there's a
Mhm.
really great comprehensive list there. And it's not crazy. It's things like water, canned food, extra medications if you need them, things like that. And little tricks, like if your power goes out for a long, long time, how would you charge your phone? How would we have this conversation right now if our laptops aren't charged and aren't working? And there's brand new devices like what I've got right here. It's an adapter for your car. So you plug this into the accessory.
Yep.
Back when we were kids, it would have been where the lighter was, but now it's an accessory. And then you can actually plug a laptop into it. You can plug a battery recharger into it if you need to recharge your flashlights. It also has a USB, so you can charge your phone at the same time. Little tricks and little things like that. The idea of using your car as a resource or finding other ways of powering your devices and being self sufficient for a certain period of time, it goes a long way for both helping yourself, helping your neighbor, and making yourself feel better. I would highly recommend it.
I think those are some very good points. I like your one about high heels, and not that I wear high heels, but even men's dress shoes can be
Yes.
uncomfortable. Not as bad as high heels, but even just something like keeping your running shoes or a pair of running shoes that you may have in your car in the event that something does happen. I think little things like that people could be doing right now, because it's bad enough that we've got the coronavirus, but you never know if some kind of other emergency pops up. Maybe it's a flood or a tornado or who knows what. It's going to be pretty hard to recover for that community and people there. So it probably is not a bad idea to be thinking about some of the things that you mentioned, and even what we might find on the federal government's website there.
The way I look at it is three different. If you want to look at them of having a home prep, that's one thing. But if you have things like three different bags, so there's an always carry. Most moms and wives already have this. It's called their purse. They
Yeah.
usually have analgesics or painkillers, band-aids, extra bottle of water, chewing gum, extra change. Actually, I would remind people it's a good idea to still carry some change, because there's not many, there are still payphones around, and they're hard lined into the system, into the grid. And in the event of an emergency, if your cell phones aren't working or if the circuits are all jammed, you can then use that payphone, and you can find them. If you look carefully at the fronts of grocery stores and at train stations, they're there. Usually hotel lobbies will have one as well still. You got to look for them. And that way, if you have an emergency contact outside of your region, you phone out and you tell him or her, I'm safe, this is where I am. If you hear from my family, please let them know. And it sets up kind of a relay point of network communication. And again, puts everybody at ease. So you can have 3 bags. You have your always carry, and that's the stuff that you'd need if you were in a pinch. You have a get home bag, and that's especially for urban workers in that environment. And again, it could just be a major transit disruption. So for example, we've seen in Ottawa weeks back, it now feels like years back,
all the time,
stranded downtown, right? And they had to wait or they had to walk. And so if you have a get home bag with comfortable shoes and extra toque, gloves, snacks, that sort of thing, that'll make you feel better. And then there's also basically a 3-day bag, something that you'd grab to leave your home. And usually for folks here in BC, it's good to have something like that for wildfire, because quite often you will only get a few minutes notice coming from the government of get out, you have to go now, and you must. And so that way, if you've got that extra bag that would have things like copies of your driver's license, digital photographs from your old photo albums, maybe a backup hard drive from your laptop, important things like that you could use to work from, you've always got it there. And you can put that together now. You don't need to go shopping for that. You probably have a lot of that technology and those backup records in your house with a spare backpack kicking around. And that just puts you at ease knowing that if you needed to, you could leave your home quickly with your family.
Yeah, that's a good point. Maybe have a USB with all your important photos, family photos on it too, so you don't lose all that family history.
Yes, exactly. It's a great thing to do. And again, your important documents, quite often you usually would have your wallet, but you never know. Something like your marriage certificate, things like that, have a scan of that all in one stick and then keep it safe, but you've got it.
Yeah, I guess even in some respects, you could put some of this stuff in an email account that you just have online in the cloud, so you don't even have to worry about the stick.
I email myself all the time.
Yeah, that's a good idea. Number 2 on our list, and this is sort of a big picture one that's kind of hard to evaluate right now, given that we're in the middle of this situation, or who knows how long it's going to go on for. But how much of a defining moment is the coronavirus in our history? I think about 9/11. We can look back at it now and see, well, we could draw a line in the sand for 9/11 in terms of how it affects our lives in different ways, some more than other. If you think about getting on an airplane, it's a totally different world after 9/11. So after the coronavirus, any thoughts on really how society is going to be affected, but then also how long it's going to take for things to resume to normal?
It's a great question. I've heard that comparison a few times now, and number one, it just feels strange right now. It feels like it's changing hour to hour, and we're seeing different government announcements day to day, and sometimes quite big shifts in their policy plans and their announcements. But I think one of the things I imagine I will take away from this months from now when I look back at it is I've become much more aware of other people in the sense of their vulnerabilities. Right now, I'm lucky to be well, and I don't have underlying medical conditions. But boy, am I ever more aware of it now in other folks. And I'm trying now to remember to keep my distance, to remember that just because I might be well, that doesn't mean the person I'm speaking to is, and I should make sure that I'm not putting them at risk. So for example, people who are in cancer treatment right now, they have really compromised immune systems. The elderly, I realize now, and it's sad that it took this to realize it, a lot of elderly are a little bit nervous to go into public anyway when they go to grocery stores. And it's something I noticed before all this happened, where I'd have an elderly person ask me to read something for them on an ingredient list where they can't see, or it's hard for them because of rotator cuff injuries over the years for them to reach the plastic bags or to grab heavy cans. It's made me more aware of that and other people. And especially there was a gentleman that I graduated junior journalism school with many years ago. His daughter is an organ donor recipient. Mm-hmm. She needed that to live. I didn't know this, but most people who receive organs are really susceptible to illness afterwards. Their immune systems are always really compromised. Mm-hmm. And he had put out a Facebook post a few days ago saying, please, I know you love my kids and I love them too, just stay away from them. Mm-hmm. So that sort of things, it's really made me realize that we need to take this sort of interactivity that we have between people while we love each other, we want to be social, we also have to be mindful of what sort of disabilities they may have.
No, for sure. It seems very hard to even imagine right now how long this is going to last because, like you say, there's so many different conflicting news stories and comments coming out from elected officials, and it's hard to know. I mean, there's so many armchair quarterbacks out there
Yeah.
right now saying some are saying, oh, it's going to be shorter. And in some countries, it even seems like it's going to be much shorter because they've done a better job at isolating those who have been infected and preventing the spread of it versus others. But I know for food for thought, Major League Baseball put out a news release, I think it was 2 days ago now, and they said 8 weeks.
Yep.
So and I think hockey, they were saying someone even suggested it might be longer before they could potentially return. So who knows? But I think it's going to be a little while for sure while we're in this state of unease. And I think it's important to think back to what we talked about in point number 2, right? Helping out businesses, helping your neighbors, all that kind of stuff. And I think this is a good segue actually to point number 1. Finally, the good news that we've seen that has come forward. I think it's important for people to think about some of the positive things that are happening. Not just at the macro level, but at the micro level, good deeds that we're hearing about, good examples of communities coming together. I've seen a story online on the National Post. They talked about how China has actually developed a vaccine. It's not clear how much we can trust China at this point, given that they've been distorting some of the information about the pandemic that's occurred in their country. But hopefully there's some truth to that. There's also a story about Washington State. They have a vaccine that they've started to test on people there. So hopefully that's those signs are encouraging that we'll get closer to getting a vaccine out there to save people from this. But also, I saw an interesting story about in Cleveland how they've developed a testing kit that has shrunk the time needed to test someone and know the results down to about 2 hours. So I thought that's really important because I think, and I'm curious what you've heard, but I think initially they were saying that the time to get the results was either like a day or 2 or something.
Yes.
It was a fairly long amount of time. So to get it shrunk down to 2 hours, I think that's certainly a step in the right direction.
There are so many brilliant people out there, and I really must tip my hat to the folks that went into math and science in the medical field. I've got medical people in my family, and they're all being called in basically to say, are you willing to go here? Are you willing to go there? Can you travel for work to more of like a hit hotspot? And the idea that we could get our testing down to just a few hours is amazing. So the amount of work being done around the world to fight this is really encouraging, and different innovations in science as well, not just directly in medicine. A lot of folks I know are concerned about things like ventilators, for example, and there's still a major concern, and I wanted to make a clear point here. The call has come out from the federal government directly. If you are a manufacturer in Canada and you can retool to develop ventilators and other medical equipment, the feds want to hear from you. They absolutely do. They put out the call about this, I think it was yesterday morning. And so that everybody's going hands on deck is very encouraging. And a quick example of that is, so apparently there's this valve or a part of a medical ventilator that was very hard to replace and very hard to find, especially in a crisis situation.
Mm-hmm.
And apparently a couple of guys with their 3D printer printed one. They took a look at it, they took all the specs from it, and they just basically create one. And they can do that over and over and over again using different polymers and plastics, and it costs about $1. And so there again, a great thing to see through scientific innovation. 3D printing, that doesn't do it justice. It's basically replicating.
Mm-hmm. And then, well, there's been some distilleries too where they're switching things up from making alcohol to making hand sanitizer. I think that's great too.
Isn't that neat to see? And so we've seen a few in Canada, and I know I saw some in Portland, Oregon, which isn't far from me here in British Columbia. So again, if you think about it, hand sanitizer is mostly alcohol. It's basically rubbing alcohol mixed with a synthetic form, usually of aloe vera gel. And that's why some people were making their stuff at home. You can go online to find a safe recipe. But what was really cool is, you're right, they have all the equipment, So they said, well, we might as well. Some of them are giving it away for free. Others are giving it away with a purchase. Others have gone full tilt on only producing hand sanitizer. And again, just to step back and marvel that we have hand sanitizer. This stuff didn't exist until, a few decades ago. We had soap and water, thankfully, but the idea that you can quickly sanitize and disinfect your hands now on the go or if you're at work is really a modern miracle. And so it's really nice to see some companies really stepping up there.
Yeah, we just have to especially make sure that when the time is right, those distilleries go back to making what we all,
yes,
we all
please.
need, alcohol. We can all have a nice drink when this is done. Now, there's certainly some other interesting things that are happening that I think are really good news examples with businesses helping people out. Shoppers Drug Mart, as one example, they said that the first hour of every day they're going to set it aside for seniors to go shopping, recognizing that that's a vulnerable population, a population that may need a little bit of extra help with their shopping. I think that's a good example. I know previously when we chatted on the phone, you had a couple examples that you had seen too.
Yeah, I did. London Drugs is doing very similar things, cordoning off some time and doing limits on purchases. So somebody who for some reason decides they need to buy 3 years of toilet paper, they're now being curtailed saying, can you manage with 3 packs, just for this one shop? So they're doing things like that. And here locally in my community here in the Fraser Valley, I know a lot of seniors were starting to get very nervous because they're, of course, very vulnerable to this disease, unfortunately, and they were getting scared to go to grocery shops in their own town, which is not nice to see. And so our local grocery store has now said the same thing that Shoppers had. For the first couple of hours every morning, it's going to be seniors' time, and folks, again, who I was mentioning earlier, who are immunocompromised, they could be more vulnerable in different ways. They're going to make sure that they've sanitized everything as best of their abilities, and they're also putting on more staff to even help some of those folks fill their grocery carts or to find their needed items. And so that way that gives them a bit of a break and should probably set their minds at ease, which is really nice to see corporate Canada and small grocery stores, mom and pop businesses, really being compassionate and very responsive. And so they've reacted very quickly and they're being very kind, which is really nice to see.
There's another little example too. I mean, the examples we've been chatting about are a little bit more bigger picture, right? Bigger companies and that, but even just things that people are doing. There's a picture online of someone somewhere who I guess lives in an apartment building or a condo building. They bought one of these big packs of toilet paper and they left it by the front door, and it said, if you need a roll, take a roll, and when you have an extra roll, put one back. And I thought, that's a nice thing to do for your community if you've got the resources to buy some toilet paper and make it available for your neighbors there. Have you seen any things like that have touched you?
Yeah, I have. There's some really nice things, actually. There was one online where a lot of, I used to live in a nice little community in Ottawa that had a lot of those little neighborhood libraries or book shares. And they're these cute little, mini houses, they look like. And they usually have a glass door and you can, leave your paperback or whatever it is and you'll pick up a new one. A lot of those ones are now being shifted over to the little mini pantries, which is really amazing to see. People are putting, sealed applesauce in there, crackers, powdered milk, canned milk, things like that, non-perishable food items in these little community spots. And that's pretty amazing. That's really nice to see. There's also some other situations with bigger companies. Again, for example, Rogers, just give you an example, has apparently waived all their overage fees. That's really nice because people are having to connect like you are and I are right now. Shaw, for example, just to be fair, they've offered free channels on educational channels, things like, the Smithsonian Institute's museum channel. So that way when your kids are home all the time, they're not only playing Nintendo, they're actually maybe learning something. So that's good to see. I also saw a news report and it was in translation, so it was hard for me to quite know exactly. It looks like the call went out, I think it was in Quebec, saying if needed, God forbid you are, but if needed, to medical personnel, is anybody available who's retired now who would be able to step up? And last I saw was around 700 nurses had said, yes, I will. That's really touching.
Yeah, that's great to see that people are willing to, in the case of nurses, get out their old uniforms and go into work where they can to help out, and doctors doing it too. It's really great to see too when you think about all the people that their jobs are so vital right now. Jason Kenney recently tweeted out, I think, a kudos to truck drivers.
Yeah.
If you think about how important those jobs are right now, they don't, I think, normally get the thanks they deserve, but all the stuff we're buying on the shelves in our local grocery stores and that, I mean, we can thank a truck driver for making that happen.
Exactly. And they already work so many long hours. And apparently now I was reading a message board amongst some of the guys there and some of the gals, and it's just round the clock. Just round the clock, always trying to keep things going. And I also really like that manufacturers and corporations and folks who run railways, for example, are putting out a lot of assurances. And I think that needs to be stressed.
Mm-hmm.
That even if you're in the grocery store and you notice some empty shelves, the supply lines are open. Stuff is coming in all the time. We're not shutting that down. What they're trying to do is to socially distance people, to stay away from each other so you don't get sick. But your stuff, your supplies are still coming. And I think that's a really good thing to point out for folks and to give these folks kudos. The grocery store workers, I can't imagine right now, and the pharmacy workers as well. They're really, really putting an extra effort in, and it's great to see.
And all those people that are involved in delivery roles too, beside trucking, but just like with Superstore, you can order your groceries online and then get it delivered to your house. Someone's doing that. Someone's delivering your skip the dishes or your pizzas,
Yes.
whatever. All this stuff that people are ordering now because they can't go into stores. Kudos to them.
And aren't we lucky to have it now? Using technology the way we are right now, other folks can do it for things like Uber Eats. They can order skip the dishes, or they can order, things online. They can pay their bills, e-bills online. They can transfer money to each other. It's really amazing when you even compare it to even say 20 years ago, let alone 100 years ago, how much we are able to do now in our day-to-day lives of getting our groceries, getting our medical supplies, even our cleaning products delivered to our home, and really minimizing that social contact. Not that we don't want to, we would love to say thank you and see them, but in order to minimize the spread of a virus, it's really quite astounding what we're able to accomplish now compared to even a few decades ago. And so I personally am very thankful to be able to see that.
Yeah, no, for sure. It's huge. We're fortunate, I think, as bad as things are, we do have a lot of things that are going in our favor, and a lot of people that are working their butts off right now. So that's probably a good note to wrap this up on. A big thank you to everyone who is, like I just said, working their butts off right now to make sure that we have food and electricity, people working in hospitals, policemen, and so forth. Chris, thanks for your time today. I appreciate all the research you did leading up to this too. You brought a lot of interesting points to consider.
Thank you. Be well.
Same to you.